Good morning. This is David Rubenshire, Market President and Publisher of the Atlanta Business Chronicle, and I am absolutely honored once again to be working with the CDC Foundation and the CDC to moderate this panel on behalf of Health Connect South. I'd like to welcome to our panel Dr. Judy Monroe, the President and CEO of the CDC Foundation, and Dr. Rochelle Walensky, who's the Director of the CDC. Welcome to both of you. It's exciting that we're able to get together. I wish this was in person, but we know what times are in, and part of the reason why we're virtual is some of the stuff we'll be talking about today. But before we get started on our conversation, Dr. Walensky, this is your opportunity to be addressing the Atlanta healthcare and business community collectively through Health Connect South. So on behalf of that community, I want to welcome you. You've spent time obviously in Boston, where you've lived, and also in Atlanta. Before we get into our substance, I was hoping maybe you'd want to give some observations of Atlanta, both as a healthcare town and also as the home to CDC, since you are going to be talking to a lot of people in your backyard.
Yeah, thank you so much. I'm so delighted to be here. Thank you so much for doing this. And thank you to the healthcare community, the public health community, for just a really warm welcome to this community. I had always known, I'd been to Atlanta before, always known Atlanta to be home to so much richness in public health, in exceptional healthcare, and through exceptional academia. I have I haven't had a lot of time, but I have started to really understand its richness in terms of culture, in terms of passion for sports, in terms of business, recreational activities. So I am really, I am looking forward to a bit of a calmer time in public health to really be able to take advantage of some of the richness I've observed here.
Great. Well, again, it's great to have you. And again, it's great to have you online with us. Dr. Monroe, I feel like as a preamble to this conversation, I feel like I've asked, it's Groundhog Day, and I'm asking this question again, but I think it's important to this audience to refresh everyone's recollection, to explain the unique and important relationship between the CDC and the CDC Foundation, because, and explain in some tight terms why they exist as separate organizations and how they serve each other.
Yeah, thanks for the question, David, and great to be back with you. So first of all, a big shout out to CDC. CDC this summer celebrated 75 years as a federal agency, celebrated that anniversary. And of course, CDC was created by Congress that many years ago. CDC Foundation was created and has now been an operating foundation. We also were created by Congress 26 years ago. And the reason for the existence of the CDC Foundation really goes back to 4 CDC directors that came together and said, you know, in all of this great work that we're doing, and as an example, the eradication of smallpox, to be able to do those really big public health initiatives, that it requires public-private partnerships and it requires coalitions. You just can't get this big work done without that support. So Dr. Bill Foege and David Satcher and other CDC directors said, really went to Congress and said, you know, we really need a foundation. And so that's how the foundation was created. We have been created as a completely independent nonprofit. If you look at our legislation, our mandate is actually quite broad to help support public health, but we have this special authority through the legislation to work directly with CDC, which makes it a very unique relationship. But it's rather powerful. And the reason for that is, you know, government obviously can do a lot. Government has a lot of powers, but they're not always able to have the speed and agility that's needed. They may not always have the funding out of the gate for certain things. And that's where we come in. So the way we help one another, you've got CDC with a deep bench in science, a lot of experts, you know, just incredible agency. And then on the other hand, you've got the foundation that can push innovation. We can bring in philanthropic funding. We like to think of our work as unleashing the power of public-private partnerships and philanthropy on behalf of public health. For me personally, a real sweet spot is when we truly have public-private partnerships, where you're leveraging federal investments with philanthropic and private investments. We also bring, you know, the power of the private sector in terms of their brain trust, right, and their skills, so that it's not always about money by any means. It's about these partnerships that can really move things. So that's how and why we exist.
So, Dr. Monroe, you mentioned to me recently an interesting collaboration that existed between your two organizations having to do with the Afghan refugees. And Dr. Walensky, I don't know if you want to share anything about it, but it was something that I don't think we've certainly not seen in the headlines, but the role that the CDC played in helping with the Afghan refugees to make sure that we brought over not only these people who are in desperate times, to make sure they were healthy, make sure they were ready to be acclimated to America. Can you guys share about how that partnership worked and what were the pieces to it?
Yeah, maybe I'll start because this has been what a unique surprise that I had when I got here to recognize the power of this partnership, the power of this friendship in being able to work together and mobilize resources. So we had tens of thousands of Afghan refugees who were coming into this country. Not all of them had had medical screening. They were rapidly evacuated and reached our soil. And we want to make sure that not only are they safe here, they're medically screened and they have the resources that they need as part of that screening, as part of any contact tracing or anything that we might need to do, and to be able to activate the science that needs to happen and to make sure that these refugees imminently could get the resources that they need was really not work that, or we didn't have the resources to leverage it so quickly. And then our first call, of course, is to Dr. Monroe, Judy, and to say, can you help and how can you help? And maybe I'll pass it to you there, Judy, to say all of the ways that you've been able to assist us as we've been trying to work to give science-driven, science-motivated recommendations for keeping these populations safe.
Yeah, so those are not uncommon calls that I'll receive from CDC saying, hey, this is what's happening and can the foundation help? And in this case, specifically, mobile phones became an issue. So you've got the evacuees coming in, they need a way, public health needed a way to communicate with them, text messages or calls to push information. We're in the middle of a pandemic, but there are other diseases, measles, chicken pox, tuberculosis. I mean, there are other disease concerns. And so how do you even begin to have that communication, and also having the two-way communication to be able to push messages to them, but also for the evacuees to reach out to public health for healthcare concerns and public health needs. And so there was, in this instance, there was no immediate mechanism for the federal government to purchase phones. And so that's where we came in. And so our team immediately went to work mobilizing resources, because we're not an endowed foundation. So we reached our donors and very thankful for the donors that have answered the call with resources. And then I have learned more about telecom companies in the last 2 weeks than I ever thought I would imagine. So we have talked to all the carriers. We had to mobilize, get contracts with the carriers, get the phones, had to have the same standard phone and have those phones delivered to the airport so Homeland Security could actually get the phones in the hands of the evacuees. So it's an example of us being both mobilizing philanthropy, but also an operating foundation. So we've been on all the calls with the team at CDC and Homeland Security and others to really operationalize this need.
Well, it feels really good to be publicizing a topic about things that are going on with the CDC and the CDC Foundation that is not necessarily related directly to COVID-19. Just because, Dr. Walensky, I feel like that's become your calling card now. I mean, I feel like I know you so well because I see you on TV every day. By the way, I have to comment that your ability to maintain your positivity through all of this and your positive energy that you exude on camera is something that I find very reassuring, even in a really tough time like this. And I try to draw from that kind of strength because I don't know how you do it, frankly.
Thank you.
And to that end, I feel like, but given who our audience is and given this opportunity, I do have to give you the opportunity in a somewhat time-stamped way, since we're a week out from when this is actually going to air, for you to comment on I think this crowd right now would be most interested in knowing about your view, this philosophy on the booster. It's such a tricky issue because part of it is you don't want to give boosters if other people need their first shot. On the other hand, is the booster really not as effective as it's supposed to be? How do you allow the general population to wrap their head around it? Because we kind of all want to know what our next step needs to be in the process.
Yeah, so maybe I will just start just by talking to the healthcare sector, healthcare workers, public health workers, and to just thank people for what they're doing, what they've been through over the last 18 months. I know it's neither marathon nor sprint because we're moving fast, but it's going for a long time. In that context, boosters is among the next questions that we're going to have to address and answer imminently. To your question of, where are we focusing, unvaccinated or boosters? I think they can't be mutually exclusive. We have to move forward and vaccinate unvaccinated people at a speedy clip because that is really a lot of what's driving things. At the same time, we do have a responsibility to make sure that people who are vaccinated maintain really good protection from the vaccine. So we've been following clinical cohorts for the last several months, many months since vaccines were first given. And so what we've been doing is watching how vaccines continue to be effective. And we're looking in many different cohorts. We're looking at hospitalizations, we're looking at healthcare workers, long-term care facilities, older populations, younger populations. And what we started to see is that the effectiveness was starting to wane with regard to disease. Some people were starting to get infected, mild disease, but starting to get infected even though they had been vaccinated. And as we were starting to see that, we said, well, we need to start planning for when these vaccines are no longer working for severe disease. And that was really the activity of what was happening in the middle of August. And so what we continue to do is follow these cohorts and report these cohorts out and the science from these cohorts, and to stay in touch with our international colleagues as well, who are starting to see that vaccine effectiveness is waning with regard to severe disease. So we're having many conversations now. The FDA is obviously going to be looking at regulatory action in terms of will boosters be regulatorily approved. And then we, of course, at the CDC will look at the risk-benefit analysis and populations for whom boosters should be immediately indicated. And that is the hard work that we have in the week ahead.
Got it. Yeah, that is very tricky. My sense is that the CDC and WHO seem to be on a better footing right now in terms of communication under your administration, which hopefully is helping all this dialogue that goes on around the delivery of the vaccine and the boosters.
Yeah, I am in frequent communication with the CDC, with the FDA. Our subject matter experts are in frequent conversation. I do think that so much of what we need to do across the government and really across the administration and across the globe is to communicate well. And part of that is to demonstrate the science that is leading to our guidance.
So moving on a little bit from COVID, I'm sure it'll come back into the conversation at some point because it's pervasive. With the change of administration has come new objectives for the CDC, and a lot of those are being supported by the CDC Foundation. So, Dr. Walensky, I've heard you talk about the importance of racism and equity as being included in the public health discourse. I've heard climate change being viewed as a public health issue, mental health as a public health issue. All these things are so critically important. And when you have all this important information that you need to put out there regarding COVID-19, you still have to get these messages out about these other things because they sort of all blend together. How do you and Dr. Monroe work together towards helping deliver those types of messages about things that aren't necessarily revolving around the COVID-19 crisis?
I will say in lockstep. So much of what we need to do in our next phase is bolster our public health infrastructure so that we're not necessarily speaking about a singular line item of I'm going to study X disease or Y. And much of that will bolster all of the things that we're talking about, and especially on the equity front. It is very clear to me when I came in and really through my work all along is to say, what are the things that are disproportionately affecting our populations where our young people are dying or people are dying younger than they should. And many of the things that you've discussed are really both different on racial and ethnic lines, as well as leading to premature death in so many young people. And so I know Judy and I have had numerous conversations about these shared goals, and I'm really just grateful for her partnership in them.
Dr. Monroe, weigh in?
Yeah, sure. So I want to start with health equity. That's an area that for the CDC Foundation last October, we hired our first Chief Health Equity and Strategy Officer, Dr. Lauren Smith. And then when Rochelle came on board as CDC director and declared racism as a public health issue and so forth, we were poised to lean in and to help the agency. So we've been doing a number of things. One, we've got a couple of projects actually supported by the Robert Wood Johnson Foundation because they're interested in data systems and what's being collected to be able to advance health equity as an example. And so Lauren Smith has been taking the lead, working with CDC leadership there to advance some of the data issues. We have a number of projects. Another area that I suggest that the foundation does is because we work with so many programs and partners out in the ecosystem. Daniel Dawes at Morehouse University at the Satcher Health Leadership Institute gave me a call last summer saying, hey, Judy, we really need more data around health equity. We've got this idea about a health equity tracker. We're trying to get partners together. And we were in a position to be able to help fund them. So we were an early funder, a partner. Again, when Dr. Smith came on board, I said, here's another project, lean in, work with Morehouse. And today that health equity tracker has received great acclaim, and it's become a national tool to help. All of that helps our health departments, our partners across the nation, and in turn helps CDC advance their mission. Because CDC, I think everybody needs to understand, CDC as a federal agency can do a lot, but so much of the work actually is taking place through health departments and through partners on the ground. So those are a few of the things, and then we're really ready to lean into climate change and mental health. Another example of mental health, we were asked by CDC to help support something called How Right Now. So you can go to howrightnow.org, or I think it's How's Now at CDC, and it'll ask you, how you feeling? You feeling angry today? You feeling frustrated? You feeling depressed? And it will then take you to resources that are going to be helpful to you, both local resources and things that you can read immediately. We funded it initially through philanthropic funds. Then CDC picked up the funding, and going forward, it's going to go to scale now because the government picked up the funding of something that philanthropy helped kickstart. Another nice example.
I feel like we're giving climate change a little bit of short shrift here in this conversation. And I think there are probably some people out there saying, well, how is climate change directly related to a mission that the CDC can contribute to? How do you articulate that? How does that get explained to the populace to understand where does climate change fit into the discussion of the Centers for Disease Control and Prevention?
Oh, it's so integral, and in fact, it's interesting that people don't recognize it. So vector-borne diseases, vectors that have changed and evolved, and actually are spreading across the United States. Where we saw Lyme disease only in one region of the United States is really moved westward and southward. We're seeing much more Lyme disease, much more tick-borne disease. So many vector-borne diseases, not just Lyme disease, but many others, really have changed because of climate change. The other is just heat. So heat, for example, impacts areas that don't have shading, don't have trees, have asphalt surrounding, or asphalt grounds. There's more heat exhaustion in areas with fewer parks, fewer trees, and we're seeing that definitely on socioeconomic grounds. We see things like hurricanes. So if we have hurricanes, where are they most going to impact? Where are people going to lose power? And then what happens if people lose power? Well, the thing that we think about highly among people, when people lose power, people don't have capacity. Dialysis. Who are our dialysis patients? Disproportionately African-American, Hispanic populations. Who are patients who might not access their chronic medical care? HIV-infected patients who need, monthly prescriptions, hypertension. All of those actually disproportionately impact minority populations. So we see it at all extremes of the weather, and we see it in vector-borne diseases. So it really impacts so much of what we do in health.
And I would just add, David, the Kresge Foundation funded the CDC Foundation, and in partnership with CDC, the Foundation, and Kresge, we did a project couple of years ago with local communities, local health departments, to build the resilience of local communities to be ready for these climate events. There's so much preparation, and that does bring all the partners together, the business community, public health, hospitals. Everybody needs to be ready as climate change is upon us.
So, as someone who's lived in Atlanta for over 30 years, I've obviously felt a lot of friendships in the healthcare community and specifically within the world of CDC. And I've never found a more dedicated group of people serving public health than the CDC practitioners to combat disease, fight for health education around the world, all these things. Yet somehow the CDC, and those people, I consider them to be some of the least political people I know. They could care less about Republicans, Democrats, who's in the White House, who's in Congress, it doesn't matter. Yet at the center, for some reason, the CDC, maybe because of its founding it was founded by Congress and it was formulated 75 years ago, it's become this political football that, both of you have to wrestle with. So how do we make it so that issues like we just talked about, like race and equity and climate change and all these things, how do they stay on the healthcare dialogue as opposed to a political dialogue? How do we create a way to depoliticize what is such an important topic and get it away from what goes on in the halls of Congress? I know that's a very hard question to answer, but
it is. Maybe I'll first let me just start with the comment you first made, and one of the great pleasures that I have had in coming to CDC over the last 9 months is just to see the huge army of people who are working here, whose names the public will never know, and who are working tirelessly to keep the public safe. All nights, every night, often, especially during COVID, just working so that someone else out there in the country will have a better outcome for what is happening. And so I do want to just double down on what you said, because it's just been so impressive. One of the things I really try and do in having this dialogue, and I've just had this dialogue related to firearm safety, is to find the places we agree. We don't necessarily have to disagree. We can have differing opinions about how to keep people safe from firearms, but can we agree that young people shouldn't commit suicide with firearms? And if we can agree on that we don't necessarily want unexpected, unanticipated deaths from firearms, then let's agree on some steps that we can make to prevent them from happening. Let's research what it is that, how more than 90% of people who have firearms have them and keep them safe. What are they doing well? Let's invite them to the table. So I think part of this is really in the context of productive discussion. We are not on different sides of the issue. There are so many places that we can agree, and let's learn from each other.
And Judy, I would think that the foundation can play a critical role in this, because you are not a political organization by nature. You're an independent body. So how do you like to work into this part of the conversation?
Yeah, so this is where we bring our partners to the table. Public health is vital to business success, and this is where business leaders can help. Just for business leaders and healthcare leaders to understand how valuable public health is, how valuable CDC is, and how we need to keep that apolitical as much as possible. They have a strong voice. They can advocate. But one of the things that businesses can do is take the guidance coming out of CDC and apply it in their business, apply it with their employees, in their communities. I mean, that then shows that trust. We need to build the trust, and that trust has to happen through many, many partners. So that's one of the ways that we approach it, is with our business partners.
So talk to me about how is a way that a business partner can take action in that regard? What are some of the things you've seen where it's been most effective at helping, again, separate the wheat from the chaff in this environment?
Yeah, so we've seen businesses do a number of things. We work with the Business Roundtable. We've got something called the Health Action Alliance that we formed with the Robert Wood Johnson Foundation. Business Roundtable, Ad Council, de Beaumont Foundation. That has been a really valuable convening of businesses, and we take, what they'll do is take CDC's guidance as an example, and translate that into the language of a CEO, maybe in toolkits that CEOs can use to communicate out to their employees. And so that that would be one example of helping build that trust and say, hey, CDC's behind this, and let's all rally. One of the things that there was a wonderful report that came out that the de Beaumont Foundation and that Johns Hopkins put out this summer with different actions that businesses can take. And one of them that they recommended that I very much like is businesses can push for dashboards of accountability, and dashboards of accountability both for economic success and for public health success in your communities, and advocate for rebuilding the public health system. That's something that businesses, we really need them to help with the rebuilding, and that includes the workforce as well as data modernization. We've got to build better data systems in this country for public health, and a lot's happening there. The other thing I would say that business leaders and healthcare leaders can do to better understand when the opportunities come is to have a relationship with your state and local health departments. Do you know your health officers? Do you know, are you tuned in to what's happening right in your own backyard when it comes to public health? Because those health departments are connected to CDC. I mean, it's one big system. They get funding from CDC, and of course they're looking at CDC guidance. So those are, I think the main thing though is the unique opportunity for businesses to raise their voice.
And Judy, you and I have had conversations with some of these businesses about safe school reopening, right? How do we keep the schools safe? How can we advocate for the schools to be safe? Because when the school's safe, the communities are safe, and the communities are safe, the businesses run.
That's right.
It was great to actually, I know the New York area schools just opened up recently, and it was great to see that happen. And for those of us with kids of school age, it's great to have our children back in class in person in many circumstances. So that's been a huge benefit. And it goes back to the emotional health piece that we talked about earlier. These kids are going to be much healthier emotionally if they're able to be with their friends and with their teachers. So that's helped quite a bit. Dr. Walensky, in closing, I'd like you to talk about you've been in this role now for 6 months.
9 months?
9 months, sorry. We get to a full gestation period, 9 months period. So coming into the job, you had certain expectations based on observing what's been going on throughout your career in public health. What has surprised you, both on the positive, and what has been a bit of a bummer for you through the process? Because I'm sure, again, you maintain such a positive stature, but it has to take its toll. And I think this audience would be curious to know about what you've liked and what you'd like to see change.
Yeah, full gestation period makes me think of labor. This has just been an extraordinary gift, an extraordinary honor and opportunity. I knew, I always say that when I was at MGH, and especially as I was dealing with COVID, if you typed C in my Google bar, CDC came up. That was my go-to place for everything that I did. Being able to sort of open the door and see the people behind it and see the extraordinary work time and time and time again, it has just been a true gift for me to understand the science that's been involved, and to really see how it's more than just the sausage being made. It's just an entire factory of just incredible people who are selfless in their dedication to making sure others are safe. I wish we weren't where we are right now in September of 2021. As somebody with a history in working in HIV, it doesn't surprise me much in an infectious disease that even with the scientific tools that behavioral science might be part of what is keeping us from being successful in this pandemic. And that is, how is it that we get people the information so that they themselves want to be vaccinated? And so I do think that we need to spend some time really understanding the those communities. We've talked a lot about workforce and public health workforce, but I do think if we had community health workers in so many communities that have been vaccine hesitant now, that had been checking diabetes and checking blood pressure control and doing all of those things, that when it came time to vaccinate, it would have been a no-brainer. They would have easily been able to convince their communities to get vaccinated. They've been trusted health providers. So we still have work to do, but I have an incredible agency behind me ready to roll up their sleeves and do that work.
And Judy, I'll let you close with, having Dr. Walensky as a partner. You've now worked with several directors over time. What's she like to work with, and what do you like in your director when you're having to have this partnership, and what are the things that make your job easier at the foundation towards achieving your goals?
Yeah, no, great question. And I would say, David, much of what you said at the beginning, and I've shared this with Rochelle, her positive energy and her presence with the media and being able to handle the tough questions and the tough job, let me say, and she's got a very hard job. I've also shared with her, I think in the 75-year history of CDC, I would say that she's walked into this position probably at the hardest moment of any CDC director. I just don't believe anyone else has walked into such an enormous challenge. So my hat's off to Rochelle for her leadership. We're working very well with CDC right now. What makes my job easier is when we have authentic dialogue with the agency, that we work together to try to understand each other's challenges and work toward a common goal. That's when we all succeed.
And that's part of the goal of Health Connect South, is to try to figure out a way to make all these things come together. So again, it's been an honor for me to be able to talk to both of you on this topic. This is a very rare and special thing that I'll probably remember for the rest of my life. So thank you very much for the opportunity. And for that, I hope everyone's enjoying the Health Connect South session virtually. And Dr. Walensky, thank you. Dr. Monroe, thank you. And with that, we sign off. Thanks a lot.
Thank you so much.
Thanks so much.